I'm Audrey Darville. I'm an associate professor at the University of Kentucky College of Nursing. I am also a tobacco treatment specialist, and I am the program director for our Breathe online tobacco treatment specialist training program. Clinically, I'm a family nurse practitioner, and I treat people for tobacco dependence, and have been doing that for a number of years, specializing in that area of content. So when I talk to people about the dangers of quitting smoking, I think most people are really aware in this day and age that smoking is bad. It's harmful to your health. But I think the important messaging opportunities that we have with tobacco dependence is to really target and tailor messaging. And I'll talk a little bit later about COVID targeted and tailored messaging strategies that you can use. But these can also apply to a variety of different settings. So thinking about, like you would any other client that you're treating with a chronic disorder, thinking about ways to make the treatment relevant to them and really feel that you can turn the tide on the negative messaging that they've gotten to framing things in a positive way. How is quitting smoking going to help me today or help me in the near future? So I think in that vein, one of the important things to communicate to people and to think about ourselves too is that quitting is a chronic condition. Tobacco use is a chronic condition. So we want to think about quitting not as a one and done, but as a process. And so it's not something that we're going to see people for one time, write them a prescription and send them on their way. But we need to have frequent contacts with them, touch base with them. We need to acknowledge that relapse to smoking is common. That's the rule rather than the exception. And by asking our clients every visit, every time about their tobacco use, that just reinforces our concern that we are helping them not just to quit, but also to stay quit. Also, goal setting can be very helpful with helping people in this quit process. So some people may feel an urgent need to quit, so they have an upcoming surgery, they have a new cancer diagnosis, they may want to quit yesterday. But for the most part, people are thinking about quitting, but very ambivalent about it. And so it's very important to make sure that we're setting goals that are client-centered. And so motivational counseling and using motivational counseling techniques are really central to tobacco treatment. We want to be sure that we're combining this counseling, client-centered counseling, with other treatment support. We can use, quit lines, online support. Smokefree.gov is a great resource that has apps, text-to-quit programs, and also make sure that we incorporate medications, because we know that for clients that use both counseling and medications, whatever form that counseling takes or multiple forms, if we combine it with medication, people are going to be much more successful. Plus, it makes their quitting experience much more pleasant if they're not experiencing severe nicotine withdrawal and cravings to smoke. So we also want to reinforce the proper use of medications. So I think as nurse practitioners, oftentimes, we're used to people taking medicines like blood pressure medicine when they feel like their blood pressure is elevated rather than taking it on a daily basis. It's important for us to look at cessation medications the same way, particularly nicotine replacement. It's most effective when it's used every day and when it's used proactively to ward off withdrawal symptoms rather than to be used if someone's having a severe craving to smoke. It's not going to work very well in that setting. And I think that same approach to using medications that we use with other conditions can be very helpful when we treat tobacco dependence. So I'm going to talk just for a minute about our Breathe Tobacco Treatment Specialist online program. Why do we talk about tobacco treatment specialists? Because it is an evidence-based body of research, literature, and clinical practice guidelines that are more complicated than just telling someone to quit. There's more involved. We do training in motivational counseling. We look at all the cessation medications. We also look at things such as the epidemiology of tobacco use, some of the risks of smoking and all form of tobacco use. We look at youth prevention. You know, those are all, I think as nurses, we can appreciate taking a holistic approach to the care of our clients and working with those clients in our communities. So the same is true for being a tobacco treatment specialist, and those are the elements that we combine in our training. So to be eligible for the training, you need to have a minimum of a high school diploma and 2 years of work in a recent human services position. So for example, we train community health workers. We also train a lot of nurses, a lot of nurse practitioners. We train physicians, psychiatrists, substance use counselors, a variety of different professions that work with people who have high prevalence of tobacco use and are at risk for tobacco-related conditions. Our program is one of over 20 accredited programs. These programs are accredited by an organization called the Council for Tobacco Treatment Training Programs. And ours is one of the first online, all online, which has turned out to be a beneficial thing for us, not having to shift gears very much during the recent COVID times. But we also provide asynchronous training. So it is self-paced learning, and I believe we are the only program that is following this format currently. What this allows us is to have greater flexibility in training. So if people are taking the training in addition to their work responsibilities, they find that they can usually get it done pretty easily, anywhere from 6 to sort of 12 weeks. Again, there's a lot of variation, and we try to really work with people to be sure that they're successful completing the program. So we have a variety of, we're in the Canvas format, so we're all online. We do a synchronous one-on-one session to evaluate skills training. And then we also have a variety of written assignments to look at critical thinking and problem solving and just basic knowledge skills. We do provide a lot of feedback with our participants, and we've gotten very positive evaluations from people who have participated in the program that feel much more confident in their ability to provide successful tobacco treatment for their clients. So as far as my own research, I started out looking at what we call hardcore or persistent smoking. And one of the interesting things that I found was that even people who it seems are very persistent in their tobacco use, they're not that different in the skills or characteristics from other smokers or other tobacco users when it comes to quitting. So there were two factors that really stood out. And one was, and this is consistent with other literature, that the more quit attempts the person makes, the more likely they are to quit. It sort of seems like a no-brainer, but oftentimes people perceive a quit attempt that doesn't result in abstinence as a failure. I see it as a stepping stone, a part of that process that I talked about with helping someone quit. So the other factor that influences people being successful with quitting, even though they have been hardcore or persistent smokers for a considerable period of time, is promoting confidence in quitting. So many times people feel beat down by their inability to quit, or just people browbeating them. And I think sometimes healthcare providers, fall into this category where, they'll hear messages like, well, this is bad for your lungs. Why are you still smoking? Or, just quit. Well, those messages aren't helpful to people. So it's really important that we engage people in motivational counseling strategies to help build their confidence. And that's where goal setting can take place. Have a role as well, because goal setting can enable us to build a sequence of successes. And again, as nurse practitioners, you're familiar with a lot of these strategies when you address and when we treat other chronic conditions. So I'm currently working with tobacco users in low SES populations and also with light intermittent smoking. Smoking patterns have changed over the years, and people who smoke lightly or intermittently have largely escaped the research lens. So I'm doing some work in that area as well. Also looking at the area of youth prevention, and that certainly has gotten more complicated in recent years with the use of Juul and pod-based devices. Juul is one example of those, but the explosion of use among youth and studies linking pod-based electronic smoking to further subsequent tobacco use or other substance use have been of great concern. And so youth prevention is another area of my focus, the focus of my research. So as far as promoting tobacco treatment on a policy level, this is so critical. Here in our state, in Kentucky, a few years ago, we've been advocating for years, and we're finally had legislation passed that now provides full coverage for Medicaid beneficiaries for all of the cessation medications and counseling. This is not true in every state, but it should be. It should be, because people need the tools and the resources to quit. Only 5 out of 100 people, and some sources even say less than that, maybe 3 out of 100 people who try to quit on their own succeed. The vast majority of people need help. And we need to, again, be thinking about this as a chronic disease, as the CDC defines it, and be able to provide that help with resources. It's also very cost effective to treat tobacco dependence. And I think a lot of legislators aren't aware of that. There was a study a number of years ago out of Massachusetts Medicaid that showed for every dollar that they spent helping someone quit smoking, they saved $3 in healthcare expenses. So it's very cost effective. Other states have shown even higher return on investment for just basic tobacco cessation coverage, medications, and counseling. It's also very critical, in addition to providing tobacco treatment, that we do ensure that all people are protected by smoke-free policies. Many people are vulnerable to the effects, the risks of secondhand smoke exposure. When we treat people for tobacco dependence, they do so much better if they're in tobacco-free environments and outside of those cues and those triggers to smoke. It's a win-win-win situation all around to have strong and comprehensive tobacco-free and smoke-free, specifically smoke-free policies. Tobacco-free is a good thing, but at minimum, smoke-free policies. A lot of smoke-free policies, by the way, are also working to incorporating aerosol protection from aerosol or vaporized aerosol that we find with the electronic smoking products. So that's something that we can advocate for within our communities and within our states. So another project that I'm working on is with a national organization, the Association for the Treatment of Tobacco Use and Dependence. I'm the immediate past president of that organization and remain actively involved, but we're looking at working with CMS to recognize tobacco treatment specialists as independent providers of services, tobacco treatment services in their own right. This will enable them the ability to bill for services and to extend the reach of availability of evidence-based tobacco treatment. I'd like to talk just briefly about the CDC's TIPS campaign. This has been an extraordinarily successful campaign, and I think they've done multiple versions, and there's one you've probably seen airing recently. And this is where people who have quit smoking for a variety of reasons, some of them have experienced very traumatic effects and health-related concerns related to their smoking, have quit and now provide brief testimonials. So our state tobacco program runs media campaigns on television and now in social media, and most states are able to contract with the CDC to run these. So I'm hoping that you've seen them, and they have really resulted in, according to the CDC website, immediate and sustained dramatic spikes in quit line calls and website visits. And data that they've collected through 2018 found that 16.4 million people made quit attempts, and 1 million people quit because of the TIPS campaign. So again, another window of opportunity to reach out to your clients and provide some material and support for maybe a tailored message that you're trying to convey to them regarding the benefits of quitting tobacco. So as far as practice pearls, I do have one practice pearl, and that's basically ask and act. Asking about tobacco use has gotten more complicated because there are multiple products. Youth use multiple products, adults use multiple products, and the product landscape is changing. We now have heat not burn products entering the environment. If you don't know what those are, look them up. They're very similar to the electronic cigarettes, but they use tobacco instead of liquid. So the landscape, the tobacco industry is always one step ahead of us in terms of the products that they're churning out and the messages that they're providing. It's very important that we ask about all forms of tobacco use, and then we act. If someone is using any form or multiple forms of tobacco use, act to the level that you feel comfortable. And if you're not comfortable, think about becoming trained as a tobacco treatment specialist. So acting may involve referring someone to the quit line. We know proactive referrals to the quit line work best. Have a system in your office and in your practice to automate or generate an automatic referral to your state tobacco quit line. This can be easily done in many states, and state tobacco programs are happy to work with you on these initiatives. So proactively refer somebody rather than just handing them a piece of paper, because we know that's more effective. Show them the resources available on smokefree.gov, multiple resources available there. There are a number of evidence-based websites. Be sure that you're recommending one that is evidence-based and not funded by the tobacco industry. But there are a lot of different options there. Check the CDC website and some of those resources that are available. So we can act in a variety of different ways. We can refer to know our local resources, like with other, like when we manage diabetes, we know our local resources at the health department, know who's offering classes, what kinds of things are going on in the community to help assist people with quitting. Again, using this chronic disease framework is really critical. And part of that chronic disease framework is my second pearl, which I really encourage you to think about. And that is to make tobacco treatment an opt-out intervention rather than an opt-in. So what do I mean by that? So with an opt-out treatment, we provide treatment by default. Everyone is offered treatment. So for example, if someone comes to see us and has a significantly elevated blood pressure, we provide treatment. If they refuse that treatment, that's the patient's prerogative, certainly, but we always offer that treatment. So after we're screening, asking about tobacco treatment, make sure that we're providing some level of treatment for all patients every visit, rather than the current model, which most treatment settings have, or most clinic settings have, where people have to opt in or ask for treatment. It is a myth that people are only able to quit if they really want to quit. Because nicotine acts on the pleasure center of the brain, people don't relish the thought of quitting. And that brings me to my final point about trying to quit during COVID times, a very stressful time for people. So people find it challenging to think about taking away sort of their lifeline, their stress lifeline, during a time when they're feeling tremendous amounts of stress. So how do we message this to people, and how do we encourage them to quit and then maybe opt out of, our recommendations rather than waiting to ask for them to, ask us, well, COVID's around, should I quit? That's not how we should approach this. We can list the specific benefits, and I've listed a few here for you. So we do know that smoking and vaping cause damage to the lungs' natural defenses against invasive bacteria and viruses. Exposed users expose themselves to chemicals that weaken the immune system and limit our body's ability to fight off infection. In addition, we know that tobacco use increases the risk of heart and lung disease, conditions which increase the risk of serious complications of COVID. A couple other things you might want to share is that, smoking and vaping, we're doing a hand-to-mouth movement. So basically, people don't have their masks on when they're smoking or vaping, and they're touching their hand to their mouth. For most people that smoke a pack a day, about 300 times a day. So that really increases their risk of exposure. A recent review of 5 published studies supports the observation that people should quit or benefit from quitting during the times of COVID, because they found that people who smoke have double the risk of severe infection compared to those who don't smoke. And some really interesting data out of Great Britain found recently that 41% of the million smokers who quit since COVID-19 said they did so because of COVID. So I think it's really important for us to use this as a window of opportunity to talk to our clients and help treat their tobacco dependence. I also would, again, encourage you to think about when you talk to people with goal setting, that reducing to quit may be another strategy. People who are stressed have a hard time of thinking about quitting like tomorrow. We sometimes will, really kind of push people towards setting a quit date when we're going to start the treatment, but we don't necessarily need to do that, especially during these periods of stress, because we know that people who reduce to quit also, have good abstinence and quit rates. So I think I've covered everything here, and I hope that some of this you'll find very motivating in terms of rethinking how you approach tobacco use in your practice. Please feel free to reach out to me if you have any questions or concerns, or if you feel like I can be of any assistance in any way. Thank you.